Welcome to this Plan International USA Policy event. I'm Justin Fugel, the head of policy here at Plan. And thank you for joining us to continue celebrating International Day of the Girl. Plan was a leading advocate for the creation of International Day of the Girl by the United Nations. And now we highlight the occasion with a whole series of events in September and October. International Day of the Girl is October 11th, but there's so much to celebrate that it takes us weeks. And this year we are marking the 12th International Day of the Girl. There were many great U.S. government events this year. The State Department's Office of Global Women's Issues had a series of events. USAID had a number of important announcements. And for the first time, the First Lady, Dr. Jill Biden, had the Girls Leading Change Awards. 15 young American women were recognized for their leadership at the White House. And that included a graduate of Plan's Youth Leadership Academy, a young woman named Mona from California who works to combat online gender-based violence. So it was wonderful to be at the White House for that, and we look forward to that becoming an annual event. As you know, it's been another very challenging year for girls and women, with many natural and man-made disasters and emergencies. And the thing is that disasters don't affect everyone equally. In the wake of catastrophe, women and girls are often the primary targets of expanding violence, exploitation, and abuse. This is because emergencies can strip away the family structures, government services, and law enforcement that help keep us all safe. And once those systems break down, the details of our lives that we cherish as individuals and that help us recognize the benefits of diversity and inclusion can disappear, leaving what appears to be an undifferentiated mass of humanity in need. And there can be a knee-jerk reaction arriving on the scene in the earliest days of a crisis to say that food, shelter, healthcare, water, and sanitation must come first. And obviously those are all vital. But unfortunately, gender-based violence also expands rapidly from the earliest moments of an emergency. As a result, gender analysis and gender-focused protection efforts cannot be seen as something that would be nice to have or something that can be added on later. Protecting adolescent girls and women is unavoidable from the very beginning of emergency response. Yet, despite their unique needs and capacities, adolescents are chronically overlooked. They fall between the cracks of child-focused response and adult-focused assistance, and neither offers tailored support for their specific needs and capacities. In a growing number of protected crises worldwide, adolescents are missing multiple years of education and are entering young adulthood without having had opportunities to develop skills, become economically independent, or contribute meaningfully to their communities and societies. This is jeopardizing their potential contributions towards the recovery from the disasters, towards peace building, and towards the long-term development of their communities and nations. Thankfully, as you'll hear today, many key actors are now working to flip that script and make gender-based protection activities part of emergency response from the very beginning. Those working to foster new models include USAID's Bureau for Humanitarian Assistance, known as BHA, other national governments, and organizations like Plan and other implementers. And this will be our topic today, both why and how that's being done. A key part of that approach is making sure young women's voices are heard and that local organizations and groups led by adolescent girls are engaged as part of the initial needs assessments on the ground. In this webinar, the speakers will discuss both the specific program benefits of applying a gender lens to emergency response, as well as how they are using those lessons learned to promote these changes across the humanitarian sector. So let's begin by introducing the speakers. First, we will hear from USAID's leader for the Bureau for Humanitarian Assistance, the assistant to the administrator for BHA, Sarah Charles. Then we will turn to two technical specialists, Reem Kamis of USAID BHA and Michelle Van Aken of Plan. Later, we will meet Viviana, a young community activist making a difference as part of a USAID-funded Plan program in Ecuador. And we'll also have time for questions from the audience. You'll be able to submit your questions using the Q&A function, and we'll turn to those towards the end of the program. So let me now introduce Sarah Charles for her keynote remarks. As the head of the Bureau for Humanitarian Assistance, the assistant to the administrator oversees USAID's disaster assistance efforts, which are the largest bilateral programs in the world. Sarah rejoined USAID from the International Rescue Committee, where she was the Senior Director of Policy and Advocacy and worked alongside many of us. Prior to that, she was acting team lead at USAID and a member of the National Security Council at the White House. While she was on the National Security Council, Sarah was responsible for humanitarian policy and coordinating worldwide assistance, including emergencies in Syria, Iraq, Central African Republic, the Philippines, and South Sudan. Sarah has also played key roles in Afghanistan. That gives you a sense of just how many crises the U.S. government responds to. And unfortunately, there are many more. In fact, Sarah is on travel now, so she pre-recorded her keynote remarks last week. Let's see those now, please.
Thank you for the opportunity to speak with you on this important occasion. International Day of the Girl Child is an essential reminder of the unique needs of girl children and adolescents in humanitarian emergencies, and a call to action for all of us to better meet those needs. Girls, especially adolescent girls, are amongst the most vulnerable to violence during a crisis. But as you've all seen firsthand, humanitarian responses often fail to plan and provide tailored activities for them. Between programs targeting adult women and child protection programs designed with school-aged children in mind, they often fall through the cracks. In recent years, BHA has been striving to support partners like PLAN to better address this gap. Last year, I traveled to Guatemala to launch Safe from the Start Revisioned, a joint USAID Department of State initiative to address gender-based violence in emergencies. On this trip, our partners universally shared that child survivors of gender-based violence and very young pregnant girls and mothers, as young as 11 to 14, urgently needed more dedicated support. Our partners emphasized the need for tailored services to address life-threatening risks to adolescent girls' physical and mental health. To tackle this problem, BHA staff in Guatemala are working to bring GBV, child protection, health, livelihoods, food, and nutrition actors together to break down silos and take a multi-sectoral approach to meeting the needs of adolescent girls. Guatemala is just one example. In Ukraine, Venezuela, South Sudan, and many other contexts around the world, BHA is proud to support protection and sexual and reproductive health services, as well as life skills training for adolescent girls. Partners like PLAN make this possible, like in Ecuador, where PLAN supported teachers and students to conduct school safety audits and develop action plans to address GBV risks, share key messages that raise awareness on girls' rights in their communities, and provide holistic, gender-sensitive support to at-risk children. While we as an international community have made so much progress in reducing risks for adolescent girls over the last several years, many challenges remain. I think of the plight of adolescent girls in Afghanistan. In many parts of the country, girls are systematically erased from public life. They're barred from much of the workforce and prevented from accessing even the most basic healthcare, social services, and of course, education. Every day we see the severe impact that isolation and lack of support and services has on women and girls' mental health, safety, and well-being. Our strategic approach in Afghanistan aims to ensure the needs of vulnerable women and girls remain prioritized, and women's roles as emergency responders are preserved and in fact enhanced. Achieving this requires continuous support to partners, negotiating with local authorities, advocacy with UN agencies to boldly uphold the IASC guidelines, and creativity in designing models for providing services to GBV survivors and others who are at risk of losing access to critically needed aid. BHA has supported our protection partners to be as flexible as possible while maintaining principled humanitarian assistance in a very complex operating environment, and to adjust and adapt unjust restrictions on women and girls' freedoms and continue to provide life-saving services. We look to this community of technical experts and longtime advocates to guide the way forward in humanitarian aid for adolescent girls around the globe, while also remembering that youth-led organizations in particular should be key actors in all child protection responses. Centering children and adolescent voices and meaningful community participation will lead to the most successful responses. I'm grateful that International Day of the Girl Child provides a yearly opportunity to acknowledge that adolescent girls are often overlooked in emergency responses. It's everyone's responsibility, national governments, implementing partners, and donor agencies, to recognize and respond to the unique protection needs of adolescent girls in emergencies. It's also crucial to recognize that adolescent girls are important actors in their own protection. They know the risks they face and often have ideas about how to best prevent, mitigate, and respond to them. I'd like to thank PLAN for hosting this event. It's an important step to bringing all of us together to learn from each other and to develop, fund, and build evidence on what works to protect adolescent girls in emergencies.
Thanks, Sarah, and thank you for those remarks and for all the important life-saving work you and your BHA colleagues are doing around the world. Thanks for promoting the focus on girls and women in emergency response. The Safe from the Start Re-envisioned initiative is very well named, and we're proud to be part of it. So let's turn now to our expert panelists for more of the details. Reem Kamis is a USAID BHA Humanitarian Protection Advisor. Michelle Van Aken is a PLAN Technical Advisor for Child Protection in Emergencies. So first, let's talk about the efforts to convince more humanitarian first responders that it's essential to include adolescent girls' voices and priorities from the very beginning. Reem, let's start with you. In her remarks, Sarah Charles spoke of the urgent need for tailored services to address life-threatening risk to the physical and mental health of adolescent girls. And she spoke of USAID bringing together the implementing partners that provide various vital services to take a multi-sectoral approach to the needs of adolescent girls, to apply a gender lens to their work. So let's explore that further. How has USAID been doing that across the humanitarian sector and within specific emergency responses?
Hello, everyone, and thank you, Justin and PLAN colleagues, for the opportunity to join you on this panel today. On your question, Justin, BHA's approach to supporting adolescent girls is really two-pronged. First, we strive to make sure that all of our partners in every sector and in every response make their aid accessible to adolescent girls. Second, and in parallel, we also provide tailored programs to meet adolescent girl-specific needs. If I can elaborate a little bit on my first point about making aid accessible to adolescent girls, as many of you know, BHA's emergency application guidelines include robust gender, age, disability, and protection mainstreaming requirements to help ensure that activities are tailored to meet the unique needs of adolescent girls and other diverse groups. Indeed, all of the applications that we receive for BHA funding are expected to provide a gender analysis that outlines the context in which partners plan to implement their programming, and also includes details on how gender, age, disability, and other inclusion factors will be considered and integrated throughout the proposed activities. And we also require areas of inclusion to be monitored and evaluated throughout the duration of those activities, those programming. So in addition to tracking the inclusion of adolescent girls at the response or at the country level, we also use our global funds to help the community at large consider the needs of adolescent girls better. For instance, a few years ago, we funded the SAFE program, which stands for Supporting Adolescents and Their Families in Emergencies, that was developed by IRC. It is basically a toolkit for collecting input from adolescents about what they need from a response, while also providing them with services, especially psychosocial support. We've seen that, in order to be truly inclusive, it's not only about bringing adolescent girls into the existing response, but also about providing them with services that are designed specifically for them. Now, going back to my other point about also providing tailored programs, within the protection sector where I sit, we fund multiple types of programs for adolescent girls, which include psychosocial support programs, life skills training, access to education, GBV prevention and response, including for child marriage and case management. BHA also understands that programs work even better when protection is integrated with other humanitarian sectors. Ideally, they aren't just co-located, they're actually designed and implemented in a truly collaborative way across sectors. This is why BHA supports integrated program for adolescent girls. And maybe just to give One example of such integrated program that we often support in a number of different contexts is linking sexual and reproductive health, what we call SRH, with adolescent life skills programming to support creating a more enabling environment for adolescent girls to access those SRH services. Another example of tailored services is also about recognizing that adolescent girls are not, they're not all the same. We're not talking about one homogeneous group. So adopting an intersectional approach means that we need to recognize that adolescent girls have different needs. They have different interests based on their realities, based on social status and other factors. And Sarah spoke about very young pregnant mothers in Guatemala that urgently needed more dedicated support. We at BHA have supported over the years the development of intersectional best practices from the field, including, for example, specific approaches to working with non-married adolescent girls and other specific approaches to working with married adolescent girls that would have a lot more emphasis, for example, on issues such as intimate partner violence and access to SRH services. The situation also exemplified a need for looking at a very young mother, herself a child, and her actual child or children as a unit, and making sure that the gender-based violence services are working in full lockstep with child protection programming. We're proud of our progress so far. We know there's a long way still to go, but we look to this community of practitioners to raise when there are gaps, either in individual responses or more broadly in policies, methodologies, or tools. Thank you.
Yeah, thanks, Reem. Yeah, it's very interesting. And Michelle, I have a similar question for you. Not working directly on this, I was very impressed by the resources of the Alliance for Child Protection and Humanitarian Action, which is a network of organizations that respond to emergencies from this perspective. And PLAN has supported the Alliance in various areas of work, including some that underscore the importance of working with adolescent girls. So tell us more about how the programmatic guidance and research helps make the case for these important changes.
Sure, absolutely. Thanks for that question, Justin. So I actually would like to spotlight one specific resource from the Alliance that I think really emphasizes the importance of focusing on girls and adolescent girls, which is the Girls Associated with Armed Forces and Armed Groups technical note. This was developed by the Children Associated with Armed Forces and Armed Groups, or CAFOG task force, which is actually co-led by PLAN, which provides technical support and capacity building to child protection actors to strengthen quality programming that prevents recruitment, facilitates release, and responds to the needs of children associated with armed forces or armed groups. Now, that is quite a mouthful. And you might be more familiar with the term child soldier, rather than this rather cumbersome phrase of children associated with armed forces and armed groups. However, the term child soldier largely excludes girls from the equation and ignores the fact that they are often forcibly recruited and forced to serve armed actors as well. It perpetuates the problem. Yes, child soldier is a bit catchier, it's faster and easier to say, but it excludes all of the girls' experiences who have been forcibly recruited. However, the definition of children associated with armed forces and armed groups encompasses both boys and girls being used by armed groups in any capacity and not just in hostilities. So this is why PLAN and UNICEF co-developed this technical note. There was an extreme lack of global guidance available to support actors in designing and implementing programs that were specifically tailored for these girls. Which meant that their experiences, their agency, and the empowerment of these girls has been neglected, which stems from a multitude of reasons, including a lack of data on girls and their experiences being forcibly recruited or being associated with armed actors. We just simply did not understand the scope or the nature of the problem. However, what we do now know is that girls are frequently used as cooks, as servants, as porters, or are even forced to marry male soldiers rather than being used actively in hostilities, though that also does occur. This gendered nature of their role means that they are less visible and therefore cases are underreported. Another issue that also makes this issue, another facet that makes this issue less visible to us is that girls are less likely to be released through a formal disarmament, demobilization, and reintegration process, which is usually facilitated for child soldiers. This process, by definition, focuses on children who carried a weapon. It's called disarmament, demobilization, and reintegration. It focuses on disarming. And the children who carry a weapon are primarily boys. So that means that girls who have also been forcibly recruited, who have also been forced to support armed actors, do not have a program that's tailored to their needs for release and reintegration. They're also less likely to actively seek out these programs due to stigma that they specifically face, especially since girls are very frequently forced to marry soldiers and bear their children. And then even in those cases where girls do manage to access this support, it's not tailored to their specific needs and experiences because these programs have been designed with boys and with child soldiers in mind. So all of these factors combined mean that girls who have been associated with armed forces and armed groups, despite going through extremely traumatic experiences, are frequently overlooked with no interventions that are specifically designed with their needs in mind, and they are released as they are released and reintegrated. And there's not even programs that are designed to think about preventing their recruitment in the first place. So the goal of this technical note, which I encourage all of you to take a look at, is to address this gap by improving the understanding of the specific needs of girls recruited by armed actors and how child protection actors can design and implement programming to address those needs. So it details key considerations and lessons learned that will support actors to develop programming that will actually support girls who have been forcibly recruited. This resource was developed through extensive desk reviews. They analyzed information collected from the study of 37 armed groups and armed forces, and they also conducted key informant interviews. So it provides information on the challenges girls specifically face during their recruitment, during their period of association, and their reintegration, information that was previously lacking. And it also provides important lessons learned and key considerations to implement gender-sensitive and gender-informed prevention, release, and reintegration programs, which is just a first step in addressing this huge gap that we've outlined. Something that's also very interesting and I think very important to note is that it considers the specific challenges faced by and the needs of girls with disabilities, which is, within a humanitarian response already, people with disabilities are extremely marginalized. When we're thinking about the fact that girls associated with armed forces and armed groups have already been overlooked, we also then need to look further into specific vulnerabilities and specific challenges that might be faced by other marginalized groups within this marginalized group. So as I said, I highly recommend reading this resource. It can be found on the Alliance for Child Protection and Humanitarian Action website. And I think that that's, just a really key example of how the Alliance is specifically trying to ensure that we are factoring in the unique experiences of girls and the specific needs of girls within our child protection programming. Thanks, Justin.
Yeah, thank you, Michelle. Right. And those are really interesting considerations, right? There are things that you would really not necessarily think of in emergency response. And yet when from interviewing the girls, from consulting with them, these are the things that we've become aware of as an organization. I know this has been true of many of our other programs as well. Consulting with the girls really improves the programs. It just allows you to target the things they are really concerned about. So speaking of programs, let's turn to some specific program examples. We'll go back to Reem. Give us some examples of some of the successful approaches that BHA has funded over the years, and some of the results focused on adolescent girls in emergencies.
Thanks, Justin. There are actually many successful interventions. It's really hard to name just a few. So in Ethiopia, for example, BHA supports plans integrated multi-sectoral assistance for IDPs, host communities, and returnees, which includes targeted support to child and adolescent survivors and those at risk of gender-based violence. Also in Ethiopia, BHA supports community safety mapping and the provision of vouchers for school supplies to out-of-school children and adolescents to basically support enrollment, but also retention in school. While this is not specifically targeted towards adolescent girls, research does show that girls are more likely to be taken out of school when households are unable to meet basic needs, which obviously in turn can increase the risk and the likelihood of early marriage and early pregnancies. And I know Michelle will speak a bit more about the work that we do in Ethiopia. Another example in Cameroon and in many other contexts, BHA supports IRC's Gershine, which is basically a life skills program that increases adolescent girls' knowledge, skills, social support structures to identify, prevent, and also seek services for gender-based violence. Another example is from Northwest Syria, where we support UNFPA and local GBV partners to implement a very cool untraditional vocational programs for girls that are embedded in women and girl safe spaces, such as robotics classes, where girls basically learn how to make robots walk. This helps strengthen the girls' mechanical abilities, but also promote problem-solving skills, self-confidence, creativity, and teamwork. At a global level, we also fund, we have a UNICEF award that is now working to ensure that frontline service providers have user-tested and improved guidance on specifically GBV case management that is tailored to responding to child, early, and forced marriages, which I think would respond to a big gap in this space. We have some partners that are implementing girls-friendly spaces, which are great in some contexts. Other partners that are working through youth and girl-led organizations, which are definitely a key way that the humanitarian community must respond to adolescent girls' needs. These are just a few examples of many successful approaches that are out there. We know and we're hearing from all of our partners that adolescent girls are at the greatest risk. So I guess building on what we know works, as well as creativity and models and approaches, as Sarah said earlier, is paramount. Thanks, Justin.
Yeah, thank you. Yeah, and also going back to what Sarah was saying earlier, Michelle, she was highlighting the USAID plan program in Ecuador that conducted gender-based violence safety audits in schools and raised awareness of girls' rights in their communities. And in a minute, we'll hear from Viviana, one of the young activists who was involved in the program, and you'll be able to see how that awareness elevated her confidence and self-esteem. But Michelle, you were recently in Ecuador, so tell us more about that program and how that brought the focus on adolescent girls to life.
Yeah, absolutely. Thanks, Justin. So first, I'd like to provide some background on gender-based violence in Ecuador, and specifically as it impacts adolescent girls in schools. In Ecuador, 65% of women experience some form of violence in their lifetime. And children, particularly girls, often face violence in schools. 60% of students between the ages of 11 and 18 have been victims of violence in their schools, and 26% are mistreated by their teachers. Between 2014 and 2018, the Ministry of Education registered 919 cases of sexual abuse against students. The highest proportion of cases, 75%, were perpetrated by teachers. And in 80% of the cases, girls were the victims. So this underscores the critical dichotomy between the importance of schools as a protective and safe environment for children to learn and grow, and the important role that educators play in child protection, and the fact that schools can also be a significant source of harm. This was only worsened by the COVID-19 pandemic, which resulted in an increase in risk of child marriage and pregnancy. According to data from the Ministry of Public Health in Santa Elena, which is one of the locations, excuse me, where we are working under this project, teenage pregnancy among girls and adolescents between the ages of 10 to 19 rose from 172 to 803 between 2020 and 2021, which is a really alarming increase of 367% during the pandemic. And another survey carried out in 22 provinces between July and August 2021 found that 38% of adolescents between the ages of 15 and 17 experienced difficulties in accessing sexual and reproductive health services during the pandemic. Further compounding this, as it was a pandemic, similar to what we experienced here in the US, opportunities to access support, reporting, and safeguarding the lives of children and adolescents were decreased significantly, which led to underreporting of GBV. So we don't really understand the full scale and scope of the problem. And then just adding some more challenges on top, in Ecuador, public institutions don't operate with the efficiency required to address the high number of sexual abuse cases. In December 2019, the national government reduced the budget allocated to the application of the law to eradicate violence against women and girls by 84%. So it went from being a budget of 5.4 million to 876,000. Which means that the implementation of government-funded GBV prevention and response actions are severely at risk and severely limited. So with this context in mind, PLAN, knowing that schools, while yes, can be a source of harm, are also a really critical protective environment, and wanting to restore schools as a protective environment for adolescent girls, we wanted to work with schools, including teachers, administrators, students, and caregivers, to assess and address the problem of GBV in schools. And we did this through 3 phases. So first, as you mentioned, Justin, we conducted a GBV safety audit, which the goal of this is to assess and identify GBV risk in school. We conducted this in 10 schools across 2 very different regions in Ecuador, but we actually found very similar findings across the schools. First, that forms of GBV, such as physical and psychological abuse, sexual harassment, and sexual abuse, are normalized practices among children and adults, which makes it difficult for them to be recognized as violent acts, and therefore for us to also prevent them. There was a generalized combination between machismo, patriarchal culture, and adult centrism, meaning that children are not considered in decision-making processes which affect them, and which generates a difficult climate to respond to GBV in the education system. The participation and empowerment of children and adolescents, especially girls, is not encouraged. It also became clear that the educational community, which can include teachers, administrative staff, lacks awareness of the Ministry of Education's prescribed reporting protocols for cases of violence, which then means that these protocols are not put into place, not implemented, and the available materials for GBV prevention are underutilized. In several cases, teachers are reluctant to talk about GBV. There was actually some pressure from the director of education to not acknowledge that this problem exists. And there's also a legitimization of physical punishment in schools, which shows the traditional gender roles are the norm. The lack of student counseling departments in most schools is also a limitation to implement and operationalize protection measures. Students don't have a place to go. They don't have somebody to talk to and somebody to advocate for them. And there is an absence of comprehensive sex education in the education system and at home. So based off of these findings, PLAN worked with teachers, administrators, and students together to collectively develop and implement work plans to address these identified risks. We socialized them on the findings, we held discussions with them in workshops, and we developed work plans, which included actions such as socializing the protocols, which were one of the findings was that people just don't know about these protocols and reporting and referral pathways. So socializing these protocols and reporting pathways with teachers and students, as well as posting these referral pathways and reporting procedures throughout the schools, conducting awareness campaigns and sessions on GBV prevention, holding these large fairs at schools to raise understanding and awareness on rights and violence prevention to improve understanding of children's rights and gender equality. In the schools, we implemented PLAN's six senses methodology, which focus on prevention of sexual abuse for children and adolescents. It builds up their capacity to self-protect and to report. And we also updated classroom codes of conduct with a gender-sensitive approach. One of the findings I found really interesting was that girls were responsible for cleaning up the classroom. So one of the changes they made was saying that all students were responsible for cleaning up the classroom at the end of the day. And another really interesting one was, have generating actions to include adolescent girls in sports, which I think is also a really key area since adolescent girls are frequently excluded from sports in schools. And then the third phase, which was run at the same time as the development of these action plans, was to strengthen the capacity of educators and administrators to better understand what is GBV how to prevent it, why are we working to prevent GBV in these schools, and then to also support them in developing their own information campaigns and providing needed material support to implement those campaigns. So overall, these campaigns and then these fairs have reached over 2,500 people to raise awareness on GBV prevention, referral routes, and the importance of gender equality. And I was actually able to visit a few of the schools where we ran this activity while I was in Ecuador, and it was really amazing to get to talk with the teachers and with the students and hear about the impact. A lot of the teachers said that they, weren't necessarily aware that this was happening in their schools and that they didn't know how to address it, and that following the support from Plan, they feel much better equipped to protect their students and respond to any reports of GBV. We were able to talk to both girls and boys who had participated in this, and the girls really emphasized that they hadn't previously felt like they had a place at the table, and that now they do feel much better able to advocate for themselves, and also that they better understand their own bodies and their own needs and their own rights, which I thought was really huge and really exciting to hear. So the schools and the teachers and the students were all really felt that this activity had a huge impact and really changed the environment and the atmosphere in the schools. And I do just want to say, I do think that we have a couple of Plan Ecuador people who have joined this panel. I just want to say a huge thanks and just to acknowledge the amazing work that they have done to really make these activities such a success. It was just exciting to see how the environment in these schools has changed. So thanks for giving me that opportunity, Justin.
Sure, of course, and yeah, thanks, Michelle, and yes, and thanks to our colleagues in Plan Ecuador for all the work they've done, and also for helping with the video we're going to see here in a minute from Viviana. So Michelle and Reem will stand by for more questions, including questions from the audience. I'd like to remind you that you can send your questions in using the Q&A function in Zoom. So Michelle was just describing the program in Ecuador. Viviana lives there high in the Andes. And you will see in the video many of the aspects that Michelle was just describing. Since Viviana's internet connection is unstable, Plan Ecuador interviewed her for this event. So let's see the video of Viviana and her community.
Mi nombre es Viviana. Tengo 17 años, estoy en tercero de bachillerato. Mi materia favorita es historia. Me gustaría estudiar la carrera de economía. Me ha gustado también estudiar ingeniera de agricultura. Y me gustaría ver a las personas que siembran bastantes cosas, hacer una venta, o sea, a una fábrica y ayudar con esas ventas. En mi casa somos entre 6 hermanos, mi papá y mi mamá, y yo soy la tercera de mis hermanos. Mi familia más se dedica a la agricultura, a los sembríos, a la cual igual mis hermanos vienen acá a ayudar a sembrar papas, habas, chochos, yo que sé, también cebada. Mi papá trabajaba unas temporadas allá en La Tacunga. Después tuvo que migrar a otro país por faltas económicas para nosotros, para nuestro bien. ¿Cómo está el clima por allá?
Pues antes ya estaba frío, hoy día ya está bien, 90 estaba de mañana.
Cuando era pequeña me gustaba jugar a las muñecas y cargar muñecas. Vino pasando los tiempos, vi a los hombres cómo se divertían jugar fútbol. Bueno, me metí igual a jugar fútbol con los hombres y así aprendí. Pasamos encerrados en la pandemia y las clases se suspendieron. Tuvimos que dar vía virtual y en ese caso no tuvimos teléfono ni internet. Bueno, un teléfono de mi papá y con un teléfono no hacíamos nada. Por esta pandemia, así como pasamos encerrados, todo eso, y pasamos juntos con familia también, y ahí si es que no hacíamos algo, o sea, sí nos regañaban. La violencia ahí vino contra nosotros, o sea, contra los niños, contra los jóvenes, que los padres nos empezaron ya a tener como mano dura Y ahí fue todo cambio, o sea, el cambio, o sea, yo cambié ahí, yo no, o sea, yo era una niña bien humilde, no me gustaban los chistes, no me gustaba nada. En el colegio era bien, o sea, bien enojona o bien, o sea, no me gustaba tanto salir a los recesos, pero hubo un cambio en la pandemia. Después de regresar al colegio, cambié para ser una chica divertida, o sea, una chica participativa, o sea, me ha dado confianza en mí y en tener confianza en todos los que me apoyan en estos momentos también. A los 10 años me afilié a Plan, ya voy a 7 años en Plan. Me siento una chica que quiere ayudar a todas las mujeres y niños para que tengan un cambio también ellos. He participado en los talleres, o sea, me ha gustado igual en esos talleres sobre que vimos la tema sobre el círculo de la violencia. Creo que se ha cambiado de actitud y ya estamos dejando un poco la violencia. Con los jóvenes de mi comunidad participamos pintando el mural y el mural se identifica como no a la violencia. Yo apoyé a las mujeres de mi comunidad que no saben escribir ni leer en las actividades que realizamos en estos talleres. En los talleres nos entregó una bolsita de protección. Dentro de la bolsa nos vino un alcohol, un jabón para manos, una gorrita. También estas tarjetitas que nos dice el abuso sexual es intolerante por los 6 sentidos. Estas tarjetas nos sirven para poder identificar o poder tener confianza con una persona adulta y contar lo que nos pasa. Cuando hay violencia intrafamiliar, no debemos quedarnos callados, tenemos que comunicarnos, o sea, avisar a los presidentes de la comuna, puede ser teniente político, policía nacional y defensores comunitarios también. Me gustaría que este proyecto continúe en mi comunidad para trabajar con niños y niñas, jóvenes y adultos mayores para prevenir la violencia y el embarazo en adolescentes. Yupaychani, USAID y Plan Internacional Kayan Kashkamundo Ñuka Comunidad.
Thank you, Viviana, and thanks again to everyone in Plan Ecuador. I always think it's powerful to talk about the strategies and the policies and the programs, and then to make the connection to one individual person. And of course, all the youth activists out there are playing such important roles in these programs and many others. And the focus on adolescent girls, of course, it's important to hear from someone like Viviana. So, Michelle, before we turn to the audience questions, I have a final one for you about how the gender lens was applied to a different emergency context, Ethiopia. Ethiopia is a complex situation with a lengthy drought and a recent civil war, generating huge vulnerabilities for girls and women. And Plan Ethiopia worked extensively on both development and emergency response with funding from USAID and other donors. So tell us how Plan has applied the focus on adolescent girls to the emergencies in Ethiopia.
Absolutely. Thanks, Justin. That video was just really impactful as well. So thank you for sharing that. I met Viviana while I was in Ecuador, and she is truly inspirational. So I'm glad that we were able to share her story. So in terms of Ethiopia, I'd like to share a bit more about our work under our BHA-funded project in Borena, Ethiopia, which Reem did briefly mention. Thank you for bringing up some of our work there. This project is specifically responding to the drought that is currently impacting large parts of Ethiopia. We're specifically working in an area called Borena. And in Borena, Assessments have shown that adolescent girls are severely impacted by the ongoing drought due to problems related to accessing water, accessing sanitation facilities, and gender-based violence incidents such as rape and unintended pregnancies. Women and girls frequently have to walk long distances to find firewood, water, and food for their families and livestock, which exposes them to an increased risk of gender-based violence. Gender-based violence cases are on the rise, including rape and early enforced marriage. As a result of the drought, dowries of money, food, and cattle, which are the traditional dowries, are declining, which is actually leading families to marry off girls at a much younger age. And the rapid needs assessment that was conducted by Plan and Barena indicated that there's been a 50% increase in child marriage in the drought-affected regions. However, government data and UNICEF analysis shows that in the overall region, so not just Barena, but also its surrounding area, the number of child marriage cases has increased by 69%. So really seeing an increase of child marriage as a coping mechanism for decreased livelihoods and loss of assets, such as cattle and livestock because of the drought. There has also been a rise in school dropouts. In two of the areas that we're working in under the project, an estimated 10,000 children are either not enrolled in school or not attending school due to lack of food from home, absence of school-provided meals, as well as a lack of toilets and hand washing stations, scholastic materials, and menstrual hygiene materials for adolescent girls. And what this means is that instead, children are increasingly engaging in child labor and street begging, both because they are not able to go to school, but also because their livelihood assets are being stripped away from this drought, which means cattle are dying off, their livestock are dying off, and so they now have to work to support their families. Drought also leads to massive migration as people move to try to find jobs in cities or in different areas, which also contributes to significant school dropout. So, while we frequently talk about the impact of conflict on adolescent girls and the increase of GBV related to conflict, I think it's less understood how natural disasters such as a drought can have a hugely negative impact on adolescent girls as they are pulled out of schools. As Reem mentioned, it is widely documented that girls are the first to be pulled out of schools before boys, but also that it increases their risks for child marriage and other harmful cultural practices as families seek any kind of coping mechanism to survive through the drought. So Plan's project in this area responds to these concerns through several different activities. So first, and most immediately, we are supporting survivors and children at risk of gender-based violence through case management. Case management is essentially, I like to call it social work light. It's very similar to the social work system that we have in the US, but it is set up in such a way that we don't need to have a social worker who has gone through very specific and very extensive schooling. It's provides a lower level of support, but similar support that we're able to implement in areas where education levels may be lower. But it does support those specific needs of girls who may have experienced sexual and gender-based violence by connecting them to needing services, providing psychosocial support, working with families, and through other means. We also are working with adolescent girls specifically through adolescent girls clubs, through communities SGBV risk mapping, and through dignity kit distributions. So these adolescent girls clubs are specific opportunities for adolescent girls to discuss challenges they're facing, to build supportive relationships, and to learn collectively to advocate for and protect their rights with the support of trained child protection staff. And the goal here is really to empower members to be advocates against abuse and exploitation for adolescent girls in their communities. This also helps, enhance their self-confidence and their understanding of their rights, which, as you heard from Viviana, is so important to their well-being and their ability to really, engage, advocate for their own agency and what they need. We're also doing GBV risk mitigation. So we work with these adolescent girls clubs as well as other community groups to do community mappings to identify community-based SGBV risks. And based off of this understanding of the risks present, we then work with the adolescent girls clubs to develop action plans to how to address these risks that are present. So again, really empowering these girls to help build a protective environment for them based on what they're identifying as the risks and what they identify as solutions. We also are providing dignity kits, which are, beyond a source of menstrual hygiene support, also help can protect girls through the provision of flashlights. So if they need to, go to a latrine in the dark, they have a flashlight. It helps through also restoring a sense of dignity. Like having access to menstrual hygiene products can be really can be really crucial for girls to feel more confident and to then be able to participate in school. And in other, day-to-day community activities. But then finally, as we mentioned, we're also providing what's called voucher assistance for child protection outcomes. So specifically seeking to support children to attend schools. So as mentioned, girls are the first to be pulled out of school. There are various barriers, largely based on cost of scholastic materials, ability to access food, and access basic needs that are preventing children from being in school. So what Plan is doing is providing voucher assistance to cover associated costs of uniforms, scholastic materials, transportation costs, which are cited as a barrier to accessing education, which will support all children, but very specifically looking at those who are pulled out of school, which is first and foremost girls, to be able to re-enroll and rejoin school. And so also trying to therefore, which will then also, mitigate the risk of child marriage, of child labor by ensuring they can stay in school. Those are just some of the steps we're taking under that project, which I think are really crucial. Thanks, Justin.
Yeah, no, thank you, Michelle. It is, I think, very helpful to see how this focus on adolescent girls is applied in different contexts and in different ways, but always with that in recognizing what their priorities are and how the program can best respond to their circumstances. I did want to turn to a question that we have about Afghanistan, and this one will be for you, Reem, because Plan does not work in Afghanistan. Just yesterday, the Georgetown Women, Peace, and Security survey came out, and they ranked Afghanistan last in the world for girls and women. And of course, Afghanistan has been a very major program from USAID. So can you tell us something about that now, about how USAID is working to have a focus on girls and women in Afghanistan?
Yeah, thanks, Justin. I'm admittedly not an expert on Afghanistan. I have other colleagues who cover, but as Sarah said, it is certainly a big challenge for all partners, especially protection partners. This is where we emphasize the importance of innovative models and maintaining flexibility, while, as Sarah said, preserving a principled humanitarian assistance. One way we've been exploring programming with our partners is really, again, going back to my point earlier about the need for integration. Integrating protection with other sectors becomes even more relevant in contexts like Afghanistan. A lot of the core protection work that we support there is integrated, for example, with nutrition, with health service delivery points and actors, since we know that health is often provides a crucial entry point for gender-based violence survivors, including adolescent girls. I'll stop there. Thanks, Justin.
Thank you. And there's another question that maybe both of you would like to answer briefly as we're coming to the end. In arriving in an emergency context, there are, of course, cultural traditions like child marriage, as Michelle was talking about. And of course, you have to set your program in the context, right? You have to meet the people where they are. So how are cultural practices taken into account in these kind of emergency response program when you have a focus on adolescent girls? I don't know which one of you wants to go first.
I can say a few words.
Sure.
Go ahead, Michelle.
You both want to go first. That's good. Go ahead, Reem.
All right, thanks. Well, I think as mentioned already by other fellow speakers, I'm not going to say a lot more here, but we know that adolescent girls are at the greatest risks of all forms of GBV when talking about early marriage, sexual violence, intimate partner violence, deprivation of education are just a few examples. In some context, we've seen reports about adolescent girls being forced by their families to take hormones, for example, to induce early puberty and therefore speed up their marriage and childbearing. So that was specific in some context. We've also seen from a lot of GBV trend analysis that we've supported through the GBV information management system that adolescent girls were really not safe anywhere. So they were the primary victims of intimate partner violence when they were married off really early, but they were also the primary victims of sexual violence by strangers. So again, just to state the fact that they're again at the greatest risk of all forms of gender-based violence. And this is where I think it is really crucial for us to continue to prioritize prevention efforts that are targeted and that are culturally sensitive, and that not only work with adolescent girls, but also engage. And that was a demand from many of the contexts where we've seen that it wasn't enough to work with adolescent girls. We also needed to engage with their caregivers, with their in-laws, other community members, including men and boys as agents of change. I think prevention models that we supported in the past also included working more broadly in the community, for example, with healthcare providers, with community leaders, to create an enabling environment for adolescent girls to access services. And over to Michelle.
Yeah, thanks, Reem. I'm just really going to echo what Reem said. When we're looking at a primary prevention approach, which seeks to prevent a harmful outcome before it can occur. So preventing child marriage before it can happen, but means addressing the underlying root causes as well as strengthening any protective factors. So plan actually, with funding from BHA and in support of the Alliance, developed a primary prevention framework for child protection and humanitarian action. And I think that's a really key starting point because it encourages child protection actors to really map and understand underlying risk factors for a specific harmful outcome, such as child marriage, as well as underlying protective factors, and to develop means of mitigating those risk factors and strengthening the protective factors. So mitigating the things that will lead to child marriage and strengthening the things that will help prevent it. And doing that it needs to be done, with a deep contextual understanding and in close consultation with communities. So we understand what's driving that and what can help stop it. And by doing that, we're taking a very contextual approach. It needs to be very tailored to each context, to each, even each community, and will help us then prevent it. But that's something that needs to be done hand in hand with communities, as Reem mentioned as well. Thank you.
Yeah, no, thank you both so much for all of your insights. And I think it's just very clear about how much work there is to do in this space and why it's so important to celebrate International Day of the Girl and use it to recognize the need for this focus throughout the year. But that's our program. I'd like to thank USAID Assistant to the Administrator for BHA, Sarah Charles, Viviana from Ecuador, and our colleagues in Plan Ecuador, Reem, Michelle, and all of you for joining us today to remember International Day of the Girl and the importance of protecting adolescent girls